Hi, I'm Josh.
I'm Gabe.
From Balanced Body Rehab. Today, Gabe and I want to talk to you about left neck pain. Now, you might be saying, why left neck pain? And it's because we commonly see people coming in with more one-sided pain, especially on the left, than the right. And so the reason people tend to develop a lot of left neck pain is kind of some universal positions people tend to get into. Gabe's demonstrating one right here. He's sitting here, but he's leaning on his right elbow and dropping his right shoulder down. And when he does this, and if he does this a lot, then his tissues on his right side start to develop more and become more tight. And over time, his body tends to stiffen up on this side, and even his breathing pattern changes, so he doesn't get as much air into his ribs on his right side, and he tends to overinflate his ribs on the left, and his muscles up here in his left neck start to turn on to try to assist in that breathing pattern. Pretty crazy, right? But it's true, it happens a lot. And so when we get people that come in with some very difficult left neck pain, or it can be on the right side too, but when they come in with very difficult one-sided neck pain and it's right around that collar region, a lot of times it can be related to this pattern. So we want to show you how to get out of it, because Gabe would, if he stayed in this pattern a lot, he'd be really tight in this area. But we could loosen it up, stretch it out, and it'd feel good for a couple hours, but then it would keep coming back on him. And the reason it keeps coming back on him is because his breathing pattern is actually causing that. So if somebody breathes 12 times a minute, that's 12 exercise contractions or muscle contractions he's getting up here to assist with the breathing pattern. And so what we need to do is actually retrain his body, retrain how the electricity turns on his muscles and how his ribs expand so that he can get a more balanced reaction through the rib cage. So to do that, we have to give him more strength or more tone in his left lower rib cage so that he gets a balanced reaction through his rib cage and he won't get the extra tone in his left neck. So that's what we're gonna do. All right, so go ahead and line your back here, Gabe. It's one exercise we give to a lot of our patients that works fairly well. It's a little more detailed, so we're gonna teach you a step-by-step here. So because Gabe breathes more through his left rib cage, there tends to be a little bit of a left rib flare. So if you have this problem and you really try to screen your rib cage, you might feel that the left rib cage is just up a little bit more than the right. If you have that, that's one of the clinical signs. So what Gabe's going to do to try to fix that is he's going to perform a contraction of his left ribs. Gabe, go ahead and lift your chin and contract right here. So he crunches on that left side. And I'm going to give Gabe a little lift here so he's not straining his neck. At home you might get a couple pillows. And so he's holding that contraction there. I'm going to have him relax his neck just a little bit. We want about a 10% contraction in the neck. He's going to really crunch this left side of his abdomen to get rid of that flare so it feels really flat here. And I don't feel that flare anymore. Then Gabe's going to lift up his left knee like this. And if I push on his knee like that, he has to use his abs to prevent his leg from moving. So that gives a bigger contraction on this left side. Gabe's going to create that resistance with his right hand. He's going to push into that knee using his abs to hold him there while crunching. And right now, because Gabe's doing that correctly, he's getting a good burn of the abdomen right there. He's going to hold that for 30 seconds because that just builds the tone in there. While he's holding that like a steel drum. Like he's not allowing that to move. But because it's 30 seconds, of course he needs to breathe. So he's going to try to breathe through the whole right side of his body there, which reverses the total effect that he's having on an everyday. So he's holding that steady, breathing through that side. After about 30 seconds, he's going to take a break because it was fatiguing out maybe, and do that 3 times. He does that a couple times a day to build the tone there. And also throughout the day, he's more aware of keeping that left rib margin down and avoiding positions such as driving in the car with his left arm up or right arm on the console that drives him into those positions as well. And over time, his left neck pain would resolve. So, hope you like this video. I hope it helps. If you like this video and want to see other videos, then join the movement. Subscribe to our channel and keep moving and feeling better. Thanks.